And one of the other things that I noticed in your approach, and you talk about it often, is the concept of lifelong aesthetic health. And what does that mean to you? And what does that sort of look like beyond the surgery itself?
Yeah, so it's yes, I really believe in like the power of these words, like really focusing on the patient's lifelong aesthetic health. And I can't take credit for these words. These are words of Dr. George Orloff from Burbank, who had sort of put this together for me. But I really, really like the concept, and I sort of stuck with it since then. But if you break down the concept, like the words, what they mean, like first of all, lifelong. Um, lifelong means like we are going to make medical and surgical decisions on your behalf, which give you a desired result now, but also the desired result will be long lasting. And also, whatever we do now should not be burning any bridges for potential future interventions later. Okay.
Mm.
And it's a very generalized way of really, very specific decisions for very specific surgeries. But, to give an example, let's say breast implants, right? Somebody wants an augmentation. To give them a good desired result now, they have choices of going really big, going really small, going above the muscle, going below the muscle, things like that. So let's customize that experience to them. If they're an athlete, they may not want an implant under the muscle because that will affect their breathing and their musculoskeletal, balance more, and they will feel that implant every time they try to do push-ups or sit-ups. So maybe for that patient, the better placement is above the muscle. If they go really big, they're going to feel that implant a lot more. So my recommendation typically is like if you are actually going to put an implant in, I would recommend putting the smallest implant you can tolerate that you'll still have a result that you'll be happy with, but go smaller rather than bigger. Because in my experience, the patients who explant, the ones that last the longest have smaller implants because it's just less of a burden on your body and they're happier longer. Whereas patients who go really big start having complications much earlier and they start having revision surgeries just earlier. And then the entire implant experience is just a disaster because it's surgery after surgery for revisions.
Right.
So that's a part of it. So we want a long-lasting result. We want a happy patient in the long term, but you also want a functional patient. And these are all questions that we, nuances that we tease out during this conversation that we're going to have before we commit to a surgery. And then the last thing: do not burn any bridges. Okay, at some point that implant might come out. At some point, the patient will say, like, well, maybe I just want my own tissue. Maybe I just want to lift. We don't want to make any incisions on the breast that will burn bridges, that will kill the blood supply to the nipple later or something like that. Okay, so these are things that I think about. And these are decisions that I make early on so that we don't have a problem 20 years later.